Hello everyone, nice to see you again. Today I'd like to talk about some secret internal files of the Chinese Communist Party, the CCP, obtained exclusively by the Epoch Times. Those documents can serve as hard evidence that the CCP's cover-ups of the COVID-19 or CCP virus pandemic. In other words, from these files we can see that the CCP knew very well in early January that the disease is transmitted from human to human and was urgently notifying health commissions at provincial and county levels and requiring them to prepare for the outbreak. However, they didn't tell the public or other countries until January 20th. And some other questions to ask regarding these documents are, if the CCP already knew the disease is transmitted from human to human in early January, did they inform the World Health Organization, the WHO? If not, why? If yes, why didn't the WHO notify other countries? Now, let's go over these very important files first. This one is marked as extremely urgent and numbered as number 19th of 2020. It was sent to all county and city level health commissions from the Health Commission of Inner Mongolia of China. The title of the file is Urgent Notice from the Health Commission of Inner Mongolia on the medical treatment of pneumonia cases of novel coronavirus infection. The notice says, to health commissions at all Meng and cities. By the way, in Inner Mongolia, Meng is an administrative level similar to county in other provinces. It is unique to Inner Mongolia. So the notice goes, in order to guide all local health commissions to do a good job in the prevention and control of novel coronavirus infection pneumonia, the National Health Commission has developed a novel coronavirus infection pneumonia diagnosis and prevention and control guidelines. Hereby, we are forwarding guidelines for diagnosis and treatment, pre-examination and separation of patients, guidelines for fever outpatients, first case confirmation procedures, prevention and control of infections inside the hospital, as well as requirements for medical personnel's personal protection. These are for internal use only and are not to be disseminated on the internet. At the same time, in order to do a good job on the medical treatment of novel coronavirus infected pneumonia, we stipulated the following. 1. Form an expert team. The file goes on to say, strengthen the treatment measures, first case confirmation procedures, and training regarding infections inside the hospital, enhance medical personnel's abilities to identify novel coronavirus infected pneumonia at an early stage, as well as the abilities to diagnose and treat it, enhance the abilities to treat patients to serve cases. Annexes. 1. List of expert team of novel corona-infected pneumonia treatment of Inner Mongolia. 2. Treatment guidance for novel coronavirus infected pneumonia draft version. 3. Requirements regarding strengthening the pre-examination and separation of patients and fever outpatient treatment. 4. Procedures of first novel coronavirus infected pneumonia case confirmation and other provinces. 5. Requirements for prevention and control of infections inside the hospital, as well as for medical personnel's personal protection. This notice was stamped and dated on January 15th with a final note that the above information is confidential and not to be released to the public. If this document was dated on January 15th, it means that the CCP already knew that it was a viral pneumonia before January 15th and was urgently alerting local health commissions and ordering them to get prepared for the outbreak. So we have to ask, why didn't they alert other countries and WHO as well? Another document is a speech made by Xu Hongzhi, the CCP's secretary and the director of Inner Mongolia Health Commission, dated on January 18th. This speech was delivered at a conference of Inner Mongolia's health system and is as long as over 10,000 words. However, in this lengthy speech, he didn't mention one word about the novel coronavirus infected pneumonia, as information of this kind of conference is open to the public. So this conference is mainly about talking about the achievements of the CCP as well as the achievement of the Health Commission. While the CCP continued to cover up the epidemic, in the following days, multiple similar notifications were sent to county and city-level health commissions one after another. This one we see was dated on January 19th with the title Notification from the Office of Inner Mongolia Health Commission regarding printing and distribution of the preliminary version of working procedures for medical treatment of novel coronavirus infected pneumonia cases. The file says to health commissions at all Hmong and cities, in order to do well on treatment of novel coronavirus infected pneumonia, the Inner Mongolia Health Commission has formulated the preliminary version of working procedure for medical treatment of novel coronavirus infected pneumonia cases. It is now being printed and distributed to you for your internal use. Spreading it on the internet is strictly prohibited. For problems you encounter in the process of carrying out the procedures, please send your feedback in a timely manner to the Administration and Management Bureau of the Inner Mongolia Health Commission. Again, a final note was added to the file to stipulate that this file is only for internal use and not to be made known to the public. After that, another file dated also on January 19th was sent to the county and city-level health commissions. The title of this file is Notification from the Office of Inner Mongolia Health Commission on Supervising the Implementation of Pneumonia Prevention and Control Work. The file says, to health commissions at all Hmong and cities. On January 14th, the National Health Commission held a national video and telephone conference on the prevention and control of novel coronavirus infected pneumonia. Following the requirement of the conference, the Inner Mongolia Health Commission printed and distributed the emergent notice from the Health Commission of Inner Mongolia on the medical treatment of pneumonia cases of novel coronavirus infection and working procedure for medical treatment of novel coronavirus infected pneumonia cases. This commission has also organized or participated in video conferences regarding prevention, control, and medical treatment of novel coronavirus infected pneumonia. In order to learn and control the implementation situations at all places, every Hmong and city need to carefully go over the implementation situation regarding epidemic prevention and control, write up a report and return it, together with the attached form, to this commission by January 23rd. Contact person Lu Yakai, contact number 047169466379. Attachment, form about implementation situations regarding relevant works. Then following those documents, on January 20th, the health commissions of Inner Mongolia at all levels issued a number of notifications, including the notice on doing well, the prevention and control of respiratory infectious diseases at the Chinese Medicine Hospital in Mongolia, the notice on implementation of work related to novel coronavirus-infected pneumonia. Notifications from the National and Inner Mongolia Health Commissions were also passed to local health commissions, including the notice on regulating the collection and delivery of samples of novel coronavirus-infected pneumonia, the emergent notice on improving the prevention and control of novel coronavirus-infected pneumonia, the notice on supervising the implementation of pneumonia prevention and control work, and so on and so forth. From all those notifications, we can see such a well thought out and thorough plan was unlikely to have been prepared in a very short period of time. This means that the CCP knew very well at a very early stage that the epidemic was about to spread on a very large scale. How early? At least before January 14th, on which day the National Health Commission organized a national video and telephone conference about it. And this is consistent with what I talked about in the programs about the timeline of CCP's cover-ups. Several labs in China had all obtained and returned the testing results of the virus to hospitals and health commissions at the end of December last year. The testing results all showed that this new virus was infectious and very similar to SARS. Also, according to a paper published at the New England Journal of Medicine and authored by researchers from the China CDC, 7 healthcare workers were infected between January the 1st to January the 11th. This means that the CCP already knew at that stage that this disease was transmitted from human to human. However, in its bulletin about viral pneumonia of unknown cause, Wuhan Health Commission lied twice, once on January 11th and once on January 14th. They said on January 11th that no infections of medical staff were found. No clear evidence of human-to-human transmission was found. On January 14th, they said that we have not found clear evidence of human-to-human transmission. However, we cannot rule out the possibility of limited human-to-human transmission, but the risk of continued human-to-human transmission is low. From the latest leaked CCP's internal secret documents we discussed today, we can see that the Wuhan Health Commission was lying, as the Inner Mongolia Health Commission had already set out very well-planned procedures regarding the epidemic prevention and control before January 15th. Another thing to notice is Inner Mongolia is very far from Wuhan. The distance between Wuhan and Hohhot, the capital city of Inner Mongolia, is about 1,800 kilometers or 1,100 miles. If the CCP really believed that the origin of the virus is the seafood market in Wuhan and that the disease is not transmitted from human to human, they should believe that anybody who had not been to the seafood market was safe and would not contract the virus. So, why did they bother to notify Inner Mongolia as well as all other provinces about how to prevent and control the disease? I understand that the US congressional Republicans are planning their own investigation into the coronavirus outbreak and examining how the World Health Organization and the CCP responded to the pandemic from the onset. So I believe these are some questions they need to look at and ask. 1. Why and when did the CCP know about the novel coronavirus infected pneumonia, as they called it? 2. What and when has the CCP reported to the WHO regarding the novel coronavirus infected pneumonia? 3. What and when did the WHO know about the novel coronavirus infected pneumonia? 4. What has the WHO done after they received information from the CCP? Let's keep asking the above questions until we have the answers. Thank you for watching. Truth does save lives. Please subscribe to my channel and share it. Thank you again. See you next time.